The USPSTF guidelines are expert recommendations that help healthcare providers and patients make informed decisions about preventive services to improve health and prevent disease. These guidelines are based on rigorous evaluations of evidence and are widely used to promote evidence-based care, reduce healthcare costs, and improve overall health. The three classes of preventive healthcare can be related to the grades of USPSTF guidelines. The USPSTF assigns letter grades to its recommendations based on the strength of the evidence for the effectiveness of the preventive service. Similarly, primary prevention can be compared to USPSTF recommendations that receive an A grade, as these are highly effective and are recommended for everyone. Secondary prevention can be compared to USPSTF recommendations that receive a B grade, as these are effective but may only be recommended for certain populations or under certain circumstances. Tertiary prevention can be compared to USPSTF recommendations that receive a C grade, as the evidence for their effectiveness is less strong and they may only be recommended in certain situations. So without further ado, let's get right into it. Abdominal aortic aneurysm, screening, men aged 65 to 75 years who have ever smoked. The USPSTF recommends one-time screening for abdominal aortic aneurysm with ultrasonography in men aged 65 to 75 years who have ever smoked. Grade B, anxiety in children and adolescents, screening, children and adolescents aged 8 to 18 years. The USPSTF recommends screening for anxiety in children and adolescents aged 8 to 18 years. Grade B, aspirin used to prevent preeclampsia and related morbidity and mortality, preventive medication, pregnant persons at high risk for preeclampsia. The USPSTF recommends the use of low-dose aspirin as preventive medication after 12 weeks of gestation in persons who are at high risk for preeclampsia. How to implement this recommendation? Assess risk. Determine if a pregnant person is at high risk for preeclampsia when obtaining the patient medical history. Pregnant persons are at high risk for preeclampsia if they have one or more of the following risk factors: history of preeclampsia, multifetal gestation, chronic hypertension, pregestational type 1 or 2 diabetes, renal disease, autoimmune disease. Combinations of multiple moderate risk factors may also be used, such as nulliparity, obesity, family history of preeclampsia, maternal age of 35 years or older, personal history factors, in vitro fertilization conception, and lower income. Black persons are associated with increased risk due to environmental, social, and historical inequities shaping health exposures, access to health care, and the unequal distribution of resources, not biological propensities. Prescribe. If patient is at high risk for preeclampsia, prescribe low-dose aspirin after 12 weeks of gestation. Grade B, asymptomatic bacteriuria in adults, screening, pregnant persons. The USPSTF recommends screening for asymptomatic bacteriuria using urine culture in pregnant persons. Grade B, BRCA-related cancer, risk assessment, genetic counseling, and genetic testing. Women with a personal or family history of breast, ovarian, tubal, or peritoneal cancer or an ancestry associated with BRCA1 or 2 gene mutation. The USPSTF recommends that primary care clinicians assess women with a personal or family history of breast, ovarian, tubal, or peritoneal cancer or who have an ancestry associated with breast cancer susceptibility 1 and 2 gene mutations with an appropriate brief familial risk assessment tool. Women with a positive result on the risk assessment tool should receive genetic counseling and, if indicated after counseling, genetic testing. Breast cancer, medication used to reduce risk, women at increased risk for breast cancer aged 35 years or older. The USPSTF recommends that clinicians offer to prescribe risk-reducing medications, such as tamoxifen, raloxifene, or aromatase inhibitors, to women who are at increased risk for breast cancer and at low risk for adverse medication effects. Grade B, breast cancer, screening, women aged 50 to 74 years. The USPSTF recommends biennial screening mammography for women aged 50 to 74 years. Grade B, breastfeeding, primary care interventions, pregnant women, new mothers, and their children. The USPSTF recommends providing interventions during pregnancy and after birth to support breastfeeding. Grade B, cervical cancer, screening, women aged 21 to 65 years. The USPSTF recommends screening for cervical cancer every 3 years with cervical cytology alone in women aged 21 to 29 years. For women aged 30 to 65 years, the USPSTF recommends screening every 3 years with cervical cytology alone, every 5 years with high-risk human papillomavirus testing alone, or every 5 years with HR-HPV testing in combination with cytology. Grade A, women younger than 21 years. The USPSTF recommends against screening for cervical cancer in women younger than 21 years. Grade D, women who have had a hysterectomy. The USPSTF recommends against screening for cervical cancer in women who have had a hysterectomy with removal of the cervix and do not have a history of a high-grade precancerous lesion. For example, cervical intraepithelial neoplasia grade 2 or 3 or cervical cancer. Grade D. Women older than 65 years. The USPSTF recommends against screening for cervical cancer in women older than 65 years who have had adequate prior screening and are not otherwise at high risk for cervical cancer. Chlamydia and gonorrhea. Screening, sexually active women, including pregnant persons. The USPSTF recommends screening for chlamydia in all sexually active women 24 years or younger and in women 25 years or older who are at increased risk for infection. Grade B. Chlamydia and gonorrhea. Screening, sexually active women, including pregnant persons. The USPSTF recommends screening for gonorrhea in all sexually active women 24 years or younger and in women 25 years or older who are at increased risk for infection. Grade B. Colorectal cancer. Screening, adults age 45 to 49 years. The USPSTF recommends screening for colorectal cancer in adults age 45 to 49 years. Grade B. Colorectal cancer. Screening, adults age 50 to 75 years. The USPSTF recommends screening for colorectal cancer in all adults age 50 to 75 years. Grade A. For adults age 76 to 85 years. Selectively screen adults age 76 to 85 years for colorectal cancer, considering the patient's overall health, prior screening history, and patient's preferences. Grade C. How to implement this recommendation. Screen all adults aged 45 to 75 years for colorectal cancer. Several recommended screening tests are available. Clinicians and patients may consider a variety of factors in deciding which test may be best for each person. For example, the tests require different frequencies of screening, location of screening, methods of screening, per-procedure bowel preparation, anesthesia or sedation during the test, and follow-up procedures for abnormal findings. Recommended screening strategies include high-sensitivity guaiac fecal occult blood test or fecal immunochemical test every year, stool DNA FIT every 1 to 3 years, computed tomography colonography every 5 years, flexible sigmoidoscopy every 5 years, flexible sigmoidoscopy every 10 years plus annual FIT, colonoscopy screening every 10 years. Selectively screen adults aged 76 to 85 years for colorectal cancer. Discuss together with patients the decision to screen, taking into consideration the patient's overall health status, prior screening history, and preferences. Depression and suicide risk in children and adolescents. Screening, adolescents aged 12 to 18 years. The USPSTF recommends screening for major depressive disorder in adolescents aged 12 to 18 years. Grade B. Falls prevention in community-dwelling older adults. Interventions, adults 65 years or older. The USPSTF recommends exercise interventions to prevent falls in community-dwelling adults 65 years or older who are at increased risk for falls. Grade B. Folic acid for the prevention of neural tube defects. Preventive medication, women who are planning or capable of pregnancy. The USPSTF recommends that all women who are planning or capable of pregnancy take a daily supplement containing 0.4 to 0.8 milligrams of folic acid. Grade A. Gestational diabetes. Screening, asymptomatic pregnant persons at 24 weeks of gestation or after. The USPSTF recommends screening for gestational diabetes in asymptomatic pregnant persons at 24 weeks of gestation or after. Grade B. Healthy diet and physical activity for cardiovascular disease prevention in adults with cardiovascular risk factors. Behavioral counseling interventions. Adults with cardiovascular disease risk factors. The USPSTF recommends offering or referring adults with cardiovascular disease risk factors to behavioral counseling interventions to promote a healthy diet and physical activity. Grade B. Healthy weight and weight gain in pregnancy. Behavioral counseling interventions. Pregnant persons. The USPSTF recommends that clinicians offer pregnant persons effective behavioral counseling interventions aimed at promoting healthy weight gain and preventing excess gestational weight gain in pregnancy. Grade B. Hepatitis B virus infection in adolescents and adults. Screening, adolescents and adults at increased risk for infection. The USPSTF recommends screening for hepatitis B virus infection in adolescents and adults at increased risk for infection. The risk for HBV infection varies by country of origin. Persons born in countries with a prevalence of HBV of 2% or greater account for the majority of cases of new chronic HBV infection in the U.S. The CDC classifies HBV endemicity levels by prevalence of positive HBsAg. Screening for hepatitis B should be performed with HBsAg tests approved by the U.S. FDA. Persons from risk groups such as those who have injected drugs in the past or currently, men who have sex with men, persons with HIV, and sex partners, needle-sharing contacts, and household contacts of persons known to be HBsAg positive should be offered HBV screening. For patients with negative HBsAg results who have not received the HBV vaccine series, periodic screening may be useful for those who report continued risk for acquiring HBV transmission. Persons with testing results indicative of acute or chronic HBV infection generally receive education about reducing the risk of transmission to others. Many persons at risk for HBV infection are not screened or vaccinated. Hepatitis B virus infection in pregnant women. Screening, pregnant women. The USPSTF recommends screening for hepatitis B virus infection in pregnant women at their first prenatal visit. Grade A. Hepatitis C virus infection in adolescents and adults. Screening, adults aged 18 to 79 years. The USPSTF recommends screening for hepatitis C virus infection in adults aged 18 to 79 years. Grade B. Human immunodeficiency virus infection. Screening, adolescents and adults aged 15 to 65 years. The USPSTF recommends that clinicians screen for HIV infection in adolescents and adults aged 15 to 65 years. Younger adolescents and older adults who are at increased risk of infection should also be screened. Screening tests. Current CDC guidelines recommend testing for HIV infection with an antigen, antibody immunoassay approved by the U.S. Food and Drug Administration that detects HIV-1 and HIV-2 antibodies and the HIV-1p24 antigen, with supplemental testing after a reactive assay to differentiate between HIV-1 and HIV-2 antibodies. If supplemental testing for HIV-1 divided by HIV-2 antibodies is non-reactive or indeterminate, or if acute HIV infection or recent exposure is suspected or reported, an HIV-1 nucleic acid test is recommended to differentiate acute HIV-1 infection from a false positive test result. Antigen, antibody tests for HIV are highly accurate, with reported sensitivity ranging from 99.76% to 100% and specificity ranging from 99.50% to 100%, and results can be available in 2 days or less. Rapid antigen, antibody tests are also available. When using a rapid HIV test for screening, positive results should be confirmed. Pregnant women presenting in labor with unknown HIV status should be screened with a rapid HIV test to get results as soon as possible. Grade A. Human immunodeficiency virus infection. Screening, pregnant persons. The USPSTF recommends that clinicians screen for HIV infection in all pregnant persons, including those who present in labor or at delivery whose HIV status is unknown. Grade A. Hypertension in adults. Screening, adults 18 years or older without known hypertension. The USPSTF recommends screening for hypertension in adults 18 years or older with office blood pressure measurement. The USPSTF recommends obtaining blood pressure measurements outside of the clinical setting for diagnostic confirmation before starting treatment. Grade A. Intimate partner violence, elder abuse, and abuse of vulnerable adults. Screening, women of reproductive age. The USPSTF recommends that clinicians screen for intimate partner violence in women of reproductive age and provide or refer women who screen positive to ongoing support services. There are different groups of people who may be at risk for abuse or violence, including older or vulnerable adults, women not of reproductive age, and men. Elder abuse and abuse of vulnerable adults is prevalent, with estimates varying, but a nationwide survey in the U.S. found that 10% of adults aged 60 years or older experienced abuse or potential neglect in the past year. Elder abuse can have negative long-term health effects, including death, higher risk of nursing home placement, and adverse psychological consequences. Women not of reproductive age, particularly those aged 45 to 54 years and older, also face a risk of experiencing rape, physical violence, or stalking by an intimate partner, with around 4% and 1% respectively having experienced such violence in the past 12 months. Men also experience sexual violence, physical violence, or stalking by an intimate partner, with more than 33% experiencing it in their lifetime. Additionally, around 34% of men report experiencing any psychological aggression by an intimate partner in their lifetime, and those who experience violence may also experience adverse effects such as fear, injury, or missing days of work or school. Screening for abuse or violence is important, but it can also have potential harms, such as shame, guilt, self-blame, partner retaliation or abandonment, and the labeling and stigma associated with false positive results. However, evidence suggests that screening is not commonly occurring in practice for older or vulnerable adults and women, with rates of routine screening varying from 2% to 50% of clinicians. There is currently no available data on screening practices for men. Grade B. Latent tuberculosis infection. Screening, asymptomatic adults at increased risk for infection. The USPSTF recommends screening for latent tuberculosis infection in populations at increased risk. Grade B. Lung cancer. Screening, adults aged 50 to 80 years who have a 20-pack year smoking history and currently smoke or have quit within the past 15 years. The USPSTF recommends annual screening for lung cancer with low-dose computed tomography in adults aged 50 to 80 years who have a 20-pack year smoking history and currently smoke or have quit within the past 15 years. Screening should be discontinued once a person has not smoked for 15 years or develops a health problem that substantially limits life expectancy, or the ability or willingness to have curative lung surgery. Grade B. Obesity in children and adolescents. Screening, children and adolescents 6 years and older. The USPSTF recommends that clinicians screen for obesity in children and adolescents 6 years and older and offer or refer them to comprehensive, intensive behavioral interventions to promote improvements in weight status. Grade B. Ocular prophylaxis for gonococcal ophthalmia neonatorum, preventive medication, newborns. The USPSTF recommends prophylactic ocular topical medication for all newborns to prevent gonococcal ophthalmia neonatorum. Grade A. Osteoporosis to prevent fractures. Screening, postmenopausal women younger than 65 years at increased risk of osteoporosis. The USPSTF recommends screening for osteoporosis with bone measurement testing to prevent osteoporotic fractures in postmenopausal women younger than 65 years who are at increased risk of osteoporosis, as determined by a formal clinical risk assessment tool. Grade B. Osteoporosis to prevent fractures. Screening, women 65 years and older. The USPSTF recommends screening for osteoporosis with bone measurement testing to prevent osteoporotic fractures in women 65 years and older. Grade B. Perinatal depression, preventive interventions, pregnant and postpartum persons. The USPSTF recommends that clinicians provide or refer pregnant and postpartum persons who are at increased risk of perinatal depression to counseling interventions. Grade B. Prediabetes and type 2 diabetes. Screening, asymptomatic adults aged 35 to 70 years who have overweight or obesity. The USPSTF recommends screening for prediabetes and type 2 diabetes in adults aged 35 to 70 years who have overweight or obesity. Clinicians should offer or refer patients with prediabetes to effective preventive interventions. Grade B. Preeclampsia. Screening, pregnant woman. The USPSTF recommends screening for preeclampsia in pregnant women with blood pressure measurements throughout pregnancy. Grade B. Prevention of dental caries in children younger than 5 years. Screening and interventions, children younger than 5 years. The USPSTF recommends that primary care clinicians apply fluoride varnish to the primary teeth of all infants and children starting at the age of primary tooth eruption. Grade B. Prevention of dental caries in children younger than 5 years. Screening and interventions, children younger than 5 years. The USPSTF recommends that primary care clinicians prescribe oral fluoride supplementation starting at age 6 months for children whose water supply is deficient in fluoride. Grade B. Prevention of human immunodeficiency virus infection, pre-exposure prophylaxis, persons at high risk of HIV acquisition. The USPSTF recommends that clinicians offer pre-exposure prophylaxis with effective antiretroviral therapy to persons who are at high risk of HIV acquisition. The USPSTF cannot validate tools to assess HIV acquisition risk accurately, but they suggest ways to identify people at high risk of HIV infection based on epidemiologic data, CDC guidelines, and clinical trial enrollment criteria. The USPSTF recommends PrEP for men who have sex with men and are sexually active, heterosexual men and women, and persons who inject drugs who exhibit certain risk factors and behaviors. Shared use of drug injection equipment and high-risk sexual activities can increase the risk of HIV acquisition. Commercial sex workers are persons trafficked for sex work, transgender men and women who are sexually active, and men who have sex with men and women should be considered for PrEP based on the criteria outlined above for men who have sex with men and heterosexually active men. Consistent use of condoms can reduce the risk of HIV acquisition by approximately 80%, but PrEP may be considered as an option for persons who use condoms inconsistently. 3 studies have observed no transmission of HIV to a seronegative partner from a partner living with HIV who was undergoing antiretroviral therapy and had a suppressed viral load, but it is unknown whether PrEP use further decreases the risk of HIV transmission. The likelihood of HIV transmission depends on the specific act or activity and the partner's HIV status, with receptive anal intercourse and needle-sharing injection drug use having the highest risk of transmission. HIV prevalence in a community or network can influence risk behaviors and should be considered when discussing PrEP use for HIV prevention. Grade A. Rh incompatibility, screening, pregnant women, during the first pregnancy-related care visit. The USPSTF strongly recommends Rh blood typing and antibody testing for all pregnant women during their first visit for pregnancy-related care. Grade A. Rh incompatibility, screening, unsensitized Rh-negative pregnant women. The USPSTF recommends repeated Rh antibody testing for all unsensitized Rh-negative women at 24 to 28 weeks gestation, unless the biological father is known to be Rh-negative. Grade B. Screening for depression in adults, general adult population, including pregnant and postpartum women. The USPSTF recommends screening for depression in the general adult population, including pregnant and postpartum women. Screening should be implemented with adequate systems in place to ensure accurate diagnosis, effective treatment, and appropriate follow-up. Grade B. Sexually transmitted infections, behavioral counseling, sexually active adolescents and adults at increased risk. The USPSTF recommends behavioral counseling for all sexually active adolescents and for adults who are at increased risk for sexually transmitted infections. STIs are transmitted through sexual activity and intimate physical contact. Common STIs in the U.S. include HIV, herpes simplex virus, HPV, chlamydia trachomatis, Neisseria gonorrhea, syphilis, and trichomonas vaginalis. All sexually active adolescents are at increased risk for STIs and should receive behavioral counseling interventions. Adults at increased risk for STIs include those who currently have an STI or were diagnosed with one within the past year, do not consistently use condoms, have multiple sex partners, or have sex partners within populations with a high prevalence of STIs. Populations with a high prevalence of STIs include persons who seek STI testing or attend STI clinics, sexual and gender minorities, persons who are living with HIV, inject drugs, have exchanged sex for money or drugs, or have entered correctional facilities, and some racial, ethnic minority groups. Intervention approaches for STI prevention include in-person counseling, videos, websites, written materials, telephone support, and text messages. Successful interventions provide information on common STIs and STI transmission, assess the person's risk for acquiring STIs, aim to increase motivation or commitment to safer sex practices, and provide training in condom use, communication about safer sex, problem solving, and other pertinent skills. Group counseling interventions with high total contact times are associated with larger STI prevention effects. Some less intensive interventions have been shown to reduce STI acquisition, increase condom use, or decrease number of sex partners. Primary care clinicians can deliver in-person behavioral counseling interventions, refer patients to behavioral counseling interventions in other settings, or inform patients about media-based interventions. Grade B. Skin cancer prevention, behavioral counseling, young adults, adolescents, children, and parents of young children. The USPSTF recommends counseling young adults, adolescents, children, and parents of young children about minimizing exposure to ultraviolet radiation for persons aged 6 months to 24 years with fair skin types to reduce their risk of skin cancer. Grade B. Statin use for the primary prevention of cardiovascular disease in adults, preventive medication. Adults aged 40 to 75 years who have one or more cardiovascular risk factors and an estimated 10-year cardiovascular disease risk of 10% or greater. The USPSTF recommends that clinicians prescribe a statin for the primary prevention of CVD for adults aged 40 to 75 years who have one or more CVD risk factors and an estimated 10-year risk of a cardiovascular event of 10% or greater. Grade B. Syphilis infection in non-pregnant adolescents and adults, screening, asymptomatic, non-pregnant adolescents and adults who are at increased risk for syphilis infection. The USPSTF recommends screening for syphilis infection in persons who are at increased risk for infection. Grade A. Syphilis infection in pregnant women, screening, pregnant women. The USPSTF recommends early screening for syphilis infection in all pregnant women. Grade A. Tobacco smoking cessation in adults, including pregnant persons, interventions, non-pregnant adults. The USPSTF recommends that clinicians ask all adults about tobacco use, advise them to stop using tobacco, and provide behavioral interventions in U.S. Food and Drug Administration approved pharmacotherapy for cessation to non-pregnant adults who use tobacco. Grade A. Tobacco smoking cessation in adults, including pregnant persons, interventions, pregnant persons. The USPSTF recommends that clinicians ask all pregnant persons about tobacco use, advise them to stop using tobacco, and provide behavioral interventions for cessation to pregnant persons who use tobacco. Grade A. Tobacco use in children and adolescents, primary care interventions, school-age children and adolescents who have not started to use tobacco. The USPSTF recommends that primary care clinicians provide interventions, including education or brief counseling, to prevent initiation of tobacco use among school-age children and adolescents. Grade B. Unhealthy alcohol use in adolescents and adults, screening and behavioral counseling interventions, adults 18 years or older, including pregnant women. The USPSTF recommends screening for unhealthy alcohol use in primary care settings in adults 18 years or older, including pregnant women, and providing persons engaged in risky or hazardous drinking with brief behavioral counseling interventions to reduce unhealthy alcohol use. Grade B. Unhealthy drug use, screening, adults age 18 years or older. The USPSTF recommends screening by asking questions about unhealthy drug use in adults age 18 years or older. Screening should be implemented when services for accurate diagnosis, effective treatment, and appropriate care can be offered or referred. Screening refers to asking questions about unhealthy drug use, not testing biological specimens. Grade B. Vision in children ages 6 months to 5 years. Screening, children aged 3 to 5 years. The USPSTF recommends vision screening at least once in all children aged 3 to 5 years to detect amblyopia or its risk factors. Grade B. Weight loss to prevent obesity-related morbidity and mortality in adults, behavioral interventions, adults. The USPSTF recommends that clinicians offer or refer adults with a body mass index of 30 or higher to intensive, multi-component behavioral interventions. Grade B.